Hi, Dr. Milky back with another foot message for you with one of my foot models. So I saw an interesting situation in my practice this week. A patient came in. She has diabetes. She's in her 60s, and she was complaining of pain and swelling on the top of the foot. And I pressed on the foot. She definitely had some pain over one of these metatarsal bones. It was somewhere in this general area. So she had gone to urgent care back a couple weeks ago, and they took an X-ray and said, you don't have a stress fracture, your foot's fine, the swelling's going to go away. But that didn't happen. She continued to have swelling and pain. So her husband had seen me. He was happy with the result. He brought her into the office, and lo and behold, I took an X-ray, and as it turned out, there was a fracture of the second metatarsal bone about right there. So they told her at urgent care there's not a stress fracture. Well, stress fractures don't show up on the X-ray right away. So we can't assume that because the first X-ray was negative, that there's not something going on with the bone. And again, in this case, it was very clear on the X-ray about 4 weeks after the onset of the pain that there was a stress fracture in the bone. So we, had to immobilize her a little bit, put her in a boot, have her rested, and she's going to do fine. But she wouldn't have had she just, listened to urgent care and said, okay, it's going to get better. It wasn't getting better. And of course, with diabetes, you don't take any chances. She still had swelling, she still had pain, and there's always a concern that there's something more serious going on. And sometimes there can be, but in this case, fortunately, it's only a stress fracture, and we'll get it fixed. But the main message here is that sometimes when people go to urgent care or emergency room or whatever, they'll say, oh, the bone looks fine, everything's going to be okay. And that's not always the case. Sometimes it just doesn't work out that easily, and we're going to have to do something about it. So follow your instincts like this smart patient did, and oftentimes we'll make the diagnosis and figure out exactly what's going on. Thanks for watching. We'll see you next time.